Everybody pays. I keep hearing people, this is not free. Nothing is ever free. I mean, that's not news. That's not dog bites man. That's man bites. That's not man bites dog. That's dog bites man. Nothing is ever free. The question is not whether it's free. The question is whether we believe in the United States of America that health insurance and health care is a right to every person, regardless of citizenship status. Because the Good Samaritan didn't ask, hey, do you have your citizenship before I put you on my donor? Hello? If I get shot, if I get run over, I sure hope that people will not ask me, where is your passport before you take me to the doctor? Not in this country. Not in this country. And so let's get off this, if they're not citizens, don't deserve care. That's a lie. They are humans. They deserve care. Every right-thinking person knows that if you don't care for people who need care, then you are not being safe, you are not being secure, you're being simple.
Who pays for it?
Can I reply to that?
Hang on,
Who pays for it?
This is what you're doing. Part of our legend just run just a little bit longer because it did lead into a question that one from the audience had, and that is, do you feel it is a constitutional right for the government to provide health care? Does it get you in the fight?
Are you talking? Yeah. Okay, that'll get me right there because it's totally unconstitutional. And if you look at your Constitution, show me in there where when you expand government, it reveals anything but socialism. And I'm concerned that we're embracing a system of total failure. And we need reform, but we don't need socialism. I have a copy right now. This has been gone over and over and over. And I'd be glad if you email me, and it's in the little brochure that you have, to send you a copy of the breakdown of this bill. And this is dangerous. Now let me say one thing. If they keep touting, we've got 47 million uninsured. So let's say we've got 25 million of those here illegally, more coming in. And do you think it's actually safe and it's a good policy to let anyone that wants to come in, we'll educate them free, we'll give them health care free, we'll feed them free. Now let me say this, in emergency care, absolutely a person should be attended to. But when they go to the emergency room with sniffles, that's another thing. Now, all I'm saying is do we think that we have the pocketbook and the resources? We've got 300 million people in this country and more coming in. Do you think that we have the pocketbook and the doctors and the nurses as an infrastructure now to support anybody that wants to come across our borders and say, come on in, it's all free, we'll take care of you? All I'm saying is I am for charity. And our brothers and sisters that gets hurt, naturally, they have the emergency room assistance. No hospital that I know of turns them away.
5 seconds. And to make it easier on myself at this point, since I can't see your faces and kind of have an idea of when we might be ready to go, let's just call cross and give everybody a chance to come across.
I will yield to this.
Okay. First off, again, no one is proposing any kind of free. This is not going to be free. It's not going to cover illegal aliens, people who are in the country who are undocumented. The president has said that over and over and over and over again. Now, as for the constitutionality of this, how many people in here are on Medicare? How many people in here have VA benefits? How many people in here have children who receive care through S-chip? All right. Those are forms of government care. I mean, that is, if we're proposing getting rid of any kind of care through the government or the government having any hands in health care, then we're getting rid of this part. The millions of people who rely on Medicare to stay alive, the millions of veterans who have veterans care every single day, that is something that we're going to get rid of, that you're proposing that we get rid of by saying the government can't have its hands in health care. I mean, that is, it's silly. I mean, come on, we need these programs. We need to expand the base of people who have coverage. And undocumented workers, any of that stuff, that's not any of these bills. I mean, it's not even worth discussing because it doesn't exist.
Hold on a second.
Hang on, no.
It doesn't exist.
That's my function as job.
Do I have any time left?
You have about 10 seconds.
Okay. Again, undocumented workers are not any of these bills. It does not exist. I promise you, it does not exist. Find it.
Okay, Okay, right here.
That's not the bill.
Hold on a second, let's say this. To clarify that part of it before another speaker comes, in Title 31 of the Senate bill, Affordable Health Choices for All Americans, Section 3105, Subtitle C, it is listed affordable coverage for all Americans. So it has a limitation that it only covers Americans. Now, my position is moderator. I'm not part of the fight here, but I do have a responsibility to keep the factual part of it sort of correct as best I can. And so there is not a jail penalty, and it is coverage in terms of insurance coverage only for Americans. And we do have to acknowledge the fact that part of why emergency rooms treat people is because the government mandates you to do so, and we subsidize emergency room treatments to an extent. So we are paying for people that don't have insurance. It's just a question of whether or not it's costing too much or not. So with that, I'll come back out and let you have 5 seconds, and then we'll come on across.
You're absolutely right about that. I mean, it's only for Americans. We're not going, the president has, and no one has said that we want to have undocumented workers in these bills. That's going to be whenever we address comprehensive immigration reform. So I can't say it enough. It doesn't exist. It's not true.
Okay, so many directions I could go here. Number one, what I'm proposing earlier is not a co-op. It is not a government public option because the government does not run it. We the people, to pull together ourselves and to actually provide that pull. The government does not need to do it. As far as whether it's constitutional or not, no. But I would not recommend at this point taking away Medicare because it's something that we've already promised is in place. We have not promised anybody the public option at this point. Okay, it says in the Federalist Papers, we look to our forefathers. James Madison argued that the general welfare in clause does not give the federal government unlimited power, rendering each of the clauses redundant. Madison asked rhetorically, for what purpose could the enumeration of particular powers be inserted if these and all others were meant to be included in preceding general power? And basically what that is saying is that the Constitution lays out what power it gives us. Healthcare was not one of those things that the government should take care of us. It only listed specific things. So to use the general welfare clause to prove that we need health insurance was against what the forefathers actually envisioned in our nation. Like I said before, we need to pull together as individuals and as churches and as groups to create the pull, okay? Because if we don't, our country, we cannot afford it. This bill is $1 trillion. How are we going to pay for it? Well, let's see, there's going to be an 8% payroll tax on employers. Well, what's that going to do, okay, if they don't provide health insurance? All right? Employers can't afford it, so they're going to either have to raise their costs, they're going to have to cut people, they're going to have to cut jobs. All right? What about all the other taxes that are in this bill to pay for? It will trickle down to each and every one of us. That's where the cost actually comes in. That's what we have to be clear about. And like I said, there is nothing in there that talks about illegal immigration. But then why, when the Republicans, all right, when they asked an amendment to completely not cover illegal, the Democrats shot it down? It doesn't matter, right? If it's not in the bill, if it is in the bill. The bill is vague enough, the way that it is written, okay, that somebody can come along later on and include illegal immigrants. And so I think that's what we need. We need to define it, but we're not defining it, but keeping it vague, that is there for a reason.
Thank you. 102 years ago, a man named Walter Rauschenberg wrote a wonderful book, Christianity and the Social Crisis. And he answered the question that David raised about the idea of churches getting together. That's hogwash. Let me tell you why it's hogwash. First of all, if the Good Samaritan figured out that there were bandits on the Jericho Road, you would imagine a bunch of Good Samaritans trying to stop bandits. But if the bandits control the road, I would expect the Good Samaritans to go to the government and say, listen, you need to run the road.